Want to live here too. Come home to Ascension Living.
If you are suffering from swelling and pain in your legs, maybe your legs feel heavy and tired, know that you are not alone. Millions of Americans find themselves facing the problems of varicose and spider veins, but they don't always seek treatment as quickly as they should. Dr. James Gooden is back this morning with Milligan Vein, where they're helping patients every day. Good to see you.
Good to see you. Thanks for having me back.
Am I right? Good to have you back. Am I right that it's millions of us who are kind of struggling with this problem unnecessarily?
Definitely. Approximately one third of Americans suffer from vein disease, and by the time we get up into our 60s, it's closer to 2/3.
So I'm glad that you said vein disease, because so often if you hear the term spider veins or varicose veins, I think you tend to think about the cosmetic side of it, but there is truly the pain that goes along with it.
Right. And it's a problem that, arises from deeper within the leg than what we necessarily see on the surface.
Right.
Spider and varicose veins, but it basically, without getting into the whole pathology of it, the veins are overpressurized. The directional flow valves within the veins they don't work anymore,
right.
And it leads to sources of inflammation within our legs.
So left untreated, will the pain just simply remain, or can the pain become a health problem?
Well, it can definitely become a health problem. The non-operative treatment of vein disease includes things like elevating your legs, wearing compression hose, losing weight. These are all things that will that can sort of palliate the disease process, but it doesn't really make it go away. So, once you take the compression hose off and you stop wearing them again, you're kind of right back to where you started.
Right. So at Milligan Vein, what do y'all do to treat it?
We have a comprehensive system for treating vein disease, and we keep it all in-house. So you come and see us, you see the doctor, you see me, and we'll evaluate you, make sure it's vein disease that we're thinking you have, and then proceed with a workup, which is really simple. It entails an ultrasound. We also have to follow some rules. These are all basically 99% of what we do is covered by insurance, and there are certain guidelines we have to follow in order to get you treated, which includes a 3-month trial of wearing compression hose or doing your best with compression therapy, elevation, and anti-inflammatory medicines. But once you've gone through that process, and that process, again, it doesn't cure the disease, it just palliates it. But once you've gone through that, we can get you in and talk about more permanent treatments.
Okay, so let's just say that someone's watching you this morning and they call and say, hey, doc, this is me.
Right.
And they come in to see you next Wednesday, just pretend.
Okay.
Then you're going to have to, for insurance purposes, if they're going to make a claim with their insurance,
right.
have to let them go through these 3 months of the compression socks before they'll be able to do the procedure?
Right, and the procedure, the preoperative treatment, these are all part of the process of getting your legs healthy again.
Okay. Compression socks are not all made the same, are they?
They're not, but we go with the guideline calls for a standard medical grade compression hose. They have to go up above the knee, and they have to be what we call 20 to 30 millimeters of mercury compression, so
okay.
they're fairly snug.
Okay, so then once that's happened, and if they still want to then proceed with treating it surgically, what is it that you will do? Okay,
so our treatments are, basically we do catheter-based ablations. So in years prior, getting your vein disease treated would have meant open surgeries and painful surgeries with longer recovery, and nowadays we're able to actually get better results with catheter-based treatment. So basically working through needles, needle work, and everything is ultrasound guided. And it's, we take a longer operation, again with a longer recovery, and we turn it into a 25-minute procedure in the office.
Wow. Okay, so are there some things that we can be doing to try to ward these off? Like, does the shoes that we wear play a role?
I don't necessarily think the shoes we wear, but I guess in terms of preventable things, we can lose weight. Anything that causes back pressure on the venous system coming out of the legs can exacerbate the problem and cause it to progress. The biggest risk factor is genetics, and there's not a whole lot we can do about that.
Okay, so they can contact your office. You're in Cleveland, right?
We are in Cleveland.
Okay.
We're in Knoxville, Cleveland, Johnson City, and Crossville, and Morristown.
Okay, So the Cleveland one's going to be the closest location for those of us here.
Yeah, absolutely.
So here's where you'll find them. 423 obviously is your area code, but 961-5682, you're welcome to call, talk through some questions, make an appointment, and then online you can learn more at milliganvein.com, and they would be happy to help you. 20 to 25 minutes of a procedure versus hours under the knife. Not bad at all.
Not bad at all. Thanks for having me.
When it comes to your health, local matters. Count on Local 3 News for expert local advice to help you stay well, live better, and raise a healthy family. Watch Eye on Health with Latrice Curry, Thursdays at 5 on Local 3 News.
Presented by the YMCA.
Black Friday at Linderman's Furniture is simple. Great savings for you. Catnapper recliners and lift chairs up to $200 off. Ashley sofa sets and sectionals up to 50% off. Power sofas up to $300 off. Sealy Split King adjustable beds $500 off. Bedroom suits up to 50% off. We pay your tax Friday and Saturday with free local delivery and free disposal of your old furniture. Linderman's Furniture, North Georgia and Chattanooga's best kept secret.
What a beautiful day here in Chattanooga.